Cervical cancer can be prevented. Here's how. Consumer Reports has no financial relationship with advertisers on this site. Since the widespread adoption of the Pap test, also called a Pap smear during the 1960s, A in the US have plummeted by about 70%, according to the American Cancer Society. And in the 1980s and 90s, research revealed that human papillomavirus HPV caused most cervical cancers. Scientists these advancements have allowed doctors to prevent cervical cancer and detect it early, says Mark Schiffman, MD, MPH, a senior investigator with the National Cancer Institute. Of all the cancers, but many women may still have questions about the best way to get screened, how often to get screened, and when to start screening or get vaccinated. Others might lack last year, for example, the U.S. Preventive Services Task Force, an independent expert panel that makes recommendations to the government and medical organizations about preventive care, updated its recommendations for cervical cancer screening to include more options for screening strategies for women between the ages of 30 and 65. The goal of cervical cancer screening is to catch potentially dangerous abnormalities early, before they become cancer or progress to a serious disease. It can take precancerous lesions on the cervix years to develop into a full-blown cancer. For the most part, here's more on the many benefits of cervical cancer screening, plus what you need to know about the different options for prevention and screening at different ages. Health experts recommend against getting screened for cervical cancer if you're younger than 21. That may seem but it's precisely because HPV is so common in young people that screening isn't a useful tool for very young people. Most HPV, but modern medicine offers another powerful tool for cervical cancer prevention in people too young to be screened via the Centers for Disease. The HPV vaccine is almost 100% effective at preventing genital warts and cervical lesions that could turn into cervical cancer, according to the CDC. The USPSTF and the American Cancer Society recommend that most women, unless they have HIV or another condition that causes a compromised immune system, begin regular screening for cervical cancer at age 21, with a Pap test every 3 years. After a Pap test, also called cervical cytology, the sample of tissue from your cervix is examined under a microscope for abnormal cells that could indicate cancer or could eventually become cancer. Pap smears are, yet experts still recommend a Pap test over an HPV test for 20-somethings. That's because a Pap test is, however, more likely to miss a worrisome cell change than an HPV test is to miss traces of the virus. That's why experts, at age 30, 2 additional cervical cancer screening options open up. You can choose to stick with a Pap test every 3 years. Another option is, all are similar experiences for the patient. Your doctor will collect cervical cells quickly and generally painlessly. It's only what they look for in the lab that's different. A virus in the case of an HPV test. Irregular cells, experts say you can wait 5 years between HPV tests because of the test's heightened accuracy compared to a Pap. A negative result, also, by the time you're 30, HPV infections are less likely to resolve on their own and may be more likely to develop into cancer. That's why the HPV co-testing is also an option, and in the US right now, in many places, co-testing may be the only available screening strategy for people who want to space their testing out every 5 years instead of every 3, according to Diane D. David, MD, Professor of Pathology and Associate Dean of Graduate Medical Education at the University of Central Florida College of Medicine. Many providers don't. Any of these strategies is a good option, says Melnikow. The bottom line is, evidence shows that in people 65 and older who had regular screenings throughout their lives, cervical cancer is rare. The USPS, the exceptions are people who've had cervical cancer, who've had a serious precancerous lesion detected in the course of screening, who may have other risk factors such as a compromised immune system, or who haven't had regular screenings. If you're in one of the, Pap and HPV tests themselves have few side effects. But any result, sometimes, however, an initial result that appears potentially worrisome is actually harmless. That's known as false. To get a sense of how big the risk for a false positive is, consider these numbers. According to a comprehensive Cochrane review published in 2017, on average, the rate of precancerous cervical lesions is about 2%, or about 20 out of every 1,000 women who get screened. Out of that same another study, published in JAMA in 2018, found that estimates of false positives ranged from 6.6 to 7.4% for HPV tests, compared with 2.6 to 6.5 for Pap tests. And according to Schiffman, some HPV tests may detect types of the virus that are highly unlikely to cause cancer. In that scenario, false positive results can cause a great deal of unnecessary anxiety. They can also lead to, finally, some treatments to remove precancerous lesions detected by screening carry risks as well. These include change. The most important thing to remember about cervical cancer screening is that the test you choose once you turn 30 isn't as important as getting screened regularly. In addition, your decision may depend on which tests are available from your provider, how often you prefer to come in for screening, and how comfortable you are with false positive results and the attendant follow-up testing. Remember, co-testing specifically may be a good choice for women who haven't been getting screened on a regular schedule, notes David. If women aren't Consumer Reports is an independent, non-profit organization that works side by side with consumers to create a fairer, safer, and healthier world. CR does not. Related video preventing and treating cervical cancer provided by Ken's TV San Antonio.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.